What are some low estrogen symptoms that you may not have known about? Let's talk about it. You may know the more common low estrogen symptoms like hot flashes and vaginal dryness, but there are quite a few uncommon low estrogen symptoms that can even beguile your healthcare providers. Number one, chronic UTIs. I see this a lot in menopausal and postmenopausal women where they have urinary tract infections treated constantly by taking antibiotics, when in reality what's happening is their estrogen levels are so low that their urethra is inflamed and allowing bacteria to enter into the bladder. The treatment is to apply topical estrogen vaginally and towards the urethra in the 12 o'clock position to reduce chronic UTIs. Number two, anxiety and depression. When your hormones have bottomed out in menopause, it affects your brain's ability to make neurotransmitters. Without adequate serotonin, dopamine, and GABA, you will feel depressed and anxious. Number three, lack of focus. Brain fog is a low estrogen symptom. Since estrogen helps stimulate neuron activity by increasing the electrical impulses in the central nervous system, so you can find those words, do that math, remember those names. When your estrogen levels are low, you have trouble focusing and concentrating. Number four, no periods or very light periods. Estrogen helps build the endometrial lining. Light, scanty periods is a classic sign that your estrogen levels are low. Without adequate estrogen, you may have no periods at all. Number five, unhealthy skin, hair, and nails. Estrogen actually stimulates the growth of skin, hair, and nails, as well as the cellular health of those tissues. When your estrogen is low, your hair may fall out, not grow as quickly, or be dry and brittle. Your skin is thin and dry and even wrinkled, and your nails are thin and brittle. Number six, poor senses. When your estrogen levels are low, your skin sensitivity is poor. You can't feel touch as well, and your sense of taste and smell can be affected. One of the classic signs I see in women who have low estrogen is they will complain that their partner stinks. And it's not because their partner has changed their hygiene habits, but that the patient's estradiol levels have fallen to the point where she now finds his smell noxious. Number seven, you need readers. If you're now using reading glasses, that's a classic sign of low estrogen. Like all hormones, estrogen affects your eyes. Low estrogen levels cause a change in the shape of the eyeball, which causes the image you're looking at to land on a different place on the macula, so that now you cannot see close. One of the most amazing things that I have found by supporting my hypothalamus with Genesis Gold is, unlike most 63-year-old women, I do not need readers. My vision has been unchanged for the last 40 years. I also had a patient who was using bioidentical hormone replacement therapy for osteoporosis. Yet, after she had been using Genesis Gold for about 2 months, she noticed a big change in her eyes. She was finally able to wear her contact lenses again. Even her optometrist noticed the change in the shape of her lens and her vision. Supporting your hypothalamus can help mitigate low estrogen levels and keep tissues healthy. Genesis Gold is more than just supporting the maestro of your hormones, it's supporting cellular health as well. If you have any questions, please join us in our hormone reboot training. I'll see you in the next video.